Today we connect with health and media experts in New York. From conspiracy theories about the origin of COVID-19 to junk science like eating garlic and using bleach to cure the virus, fake news and disinformation have been spreading as fast as the virus itself across social media, the internet, and even on mainstream media. This has really not been helpful in society's handling the deadly pandemic, only promoting greater fear and mistrust, questionable health advice, xenophobia, and even the hoarding of toilet paper. To discuss how we can combat this so-called infodemic, we connect with Bruce Wiley, Doctor of Medicine and medical journalist, and Jeremy Kaplan, Editor-in-Chief of Digital Trends, both joining us from New York. Well, let's start with the most outlandish fake news or disinformation that you've heard regarding the COVID-19. I'd like to hear from both of you. Why don't we start with Dr. Lee?
Well, that's hard to choose because there's so many possibilities that are out there. So I can name a few. So one is that this virus is somehow engineered or designed or manufactured as a bioweapon in a lab, and for some reason released deliberately, and it's not clear why someone would do that. But the scientific evidence is getting clearer and clearer that this came from a natural source. There's a very close correlation between the genetic sequencing of the sequences of the virus and the viruses found in bats. So that's one rumor or conspiracy theory that's out there. And then there's all this bogus therapies that are being suggested that you can try different types of supplements or different types of herbal medications, or even like hydrogen peroxide or oregano oil. So lots of stuff like that.
The bleach theory was quite scary for me. Well, what about you, Mr. Kaplan?
Yeah, the misinformation around health is particularly nefarious, potentially leading people to try the wrong thing, of course, but potential health impacts on themselves. I find also scary just the general misinformation around what's happening in society. So there was a huge rumor that spread across the country, that Trump was going to close down the borders and put a general lockdown on the U.S. This was spreading via text message over the weekend. It got so bad, in fact, that the U.S. government had to issue an official response on Twitter saying, no, we have no immediate plans to do that. But not before millions of people had exchanged these messages. That just creates this general sense of fear and concern, which we should have, of course, but exacerbating it through false information, it's really just nefarious. The other thing that struck me as particularly gross was false information around a vaccine. I saw a number of reports that the Chinese government has a vaccine. Not true. I'm sure the Dr. Lee can corroborate. Not true at all. But the fact that people would start thinking about that and fretting about it, the implication that one government is holding it hostage and not providing it to others, creates just this broader sense of uncertainty, which is just not useful in this environment.
Exactly. Even if it's something as silly as eating garlic, it doesn't really amount to anything helpful at all at this point and in this situation. Well, Dr. Lee, as a journalist and a doctor of medicine, how does it make you feel to read all these bizarre bits of information floating around the web, and especially when they come from the media accounts or the mouths of celebrities or public figures?
Yeah, these things have real impact. So it's easy to forget that all information that goes out there is actually affecting people. So ranging from people may do certain things and neglect to do other things. Like, for instance, social distancing is important. But if they feel that there's some other magical cure they can drink or rub on themselves or what have you, they may be doing that instead. Or it may raise the level of panic or suspicion or mistrust, which is especially a problem when everyone needs to cooperate. So everyone needs to cooperate and social distance and flatten the curve. But you have these situations, like, for instance, to continue the point about the vaccine, I've seen rumors floating out there that this pandemic was started because someone wanted to sell a vaccine. So that's another hoax that's out there, that they already have vaccines, and let's either start a pandemic as a hoax or actually start a pandemic to actually sell the vaccine, which makes absolutely no sense. We're far from having a vaccine out there. People are talking about there's certainly not going to be a vaccine within the year and beyond. So if you look at the science, it doesn't make sense. But this really creates this very confusing mess that then makes it difficult to actually push out the real facts. So the real facts get lost in this tornado of other information that's out there.
Right, and all this fake news or disinformation, it really does come in various forms, whether they're just tweets from celebrities or online articles, and we even see them floating around in traditional media as well. Well, Mr. Kaplan, as a figure in media, does it worry you just how advanced and widely dispersed that fake news or disinformation has become, and how it's been so prevalent throughout this entire crisis as well?
Yeah, it really does bother me. To piggyback on what Dr. Lee said, it obfuscates the actual information. And at a time like this, when it's important for actual facts from actual doctors and from the actual government to get out there, it hurts that people would intentionally or maliciously or even unintentionally spread this type of information. The other thing I wanted to point out is I think we're all fairly aware at this point that certain platforms, notably Facebook and Twitter, have had this pervasive issue about fake news. What we've been seeing lately is the rise and spread of fake news on other platforms as well. If I mentioned the cell phone thing, for example, we saw a huge spread on WhatsApp of fake information. And even on TikTok now, there's been the spread of false information. Again, perhaps intentional, perhaps not, but regardless, it gets in the way of the real information, which we really need to be sharing and getting out there.
And being editor-in-chief, when you see some journalists just using, fake information just to create headlines, or perhaps they're not aware that it's really fake information, what do you think should be done? Do you think this is all just lazy journalism, basically?
Yeah, that's a very difficult question. I mean, there was a period in time when there was a rush to get online and to get information out as quickly as possible. And yeah, you definitely saw people you saw something, you rushed to write it, whether or not you could verify the information. We've certainly put in some rules in place at Digital Trends to ensure that we don't do that. Go directly to the source, talk to somebody else, see if you can corroborate through an official that you trust. But it is very frustrating to see somebody scrambling to get news out quickly and not necessarily be getting out something accurate or even factual.
Right, it's not necessarily the case of, the faster the better. We really have to take time and make sure that everything is correct. I mean, that is very important. Well, Dr. Lee, I must admit some fake news content can give us a good laugh when it's very obviously fake. But when it affects your health or safety, then really it's no laughing matter. And I'd say that goes for any news that goes unchecked. For instance, France's health ministry very recently having suggested that painkillers such as ibuprofen could worsen the effects of the coronavirus. Many experts have criticized that this hasn't been verified. Well, what are your thoughts on this? And what kind of medical disinformation should we be rather wary of?
Yeah, we're in a difficult situation because on the one hand, scientists would like to get out information as quickly as possible because there needs to be a discourse. So, the trouble with this situation is this is a novel virus, so there aren't established treatments, there aren't established ways to handle the virus. So many scientists are trying to get out the information as quickly as possible. So that's important. But then we've seen situations where something will be posted, like there are these platforms where you can post preprints before actually publishing a paper and having go through peer review, but then it can be used in many different ways. So we have to strike the balance between sharing information, but then having people misinterpret very quickly. So the question with the ibuprofen, it's very early. It's based on some initial information, and it really needs to be vetted by other scientists and the scientific community to determine whether this is something to be of concern.
Particularly tough, I would add, because it's hard for consumers, for ordinary people, to digest some of the medical knowledge, the information that you can probably get to much more easily. So when you see a paper, it's very hard to know if you can actually trust that. And I think that's one reason that people are more likely to be susceptible to the fake news that gets spread around. Oh, this fixes that problem. Great, I like that. That's an easy solution. May not be true, though.
Absolutely.
And as a reporter myself, I find it incredibly difficult to write about medical issues and health issues, and even when it comes to, the names of medicine and drugs and things like that. So the question goes to both of you, really. What do you think should be done to help mainstream media, journalists as well, be just as quick, adept at responding to these stories, but also getting our facts straight at the same time?
Well, one issue is when you do see a study, is that the only study that shows something? Or is it part of a series of studies, or have other studies confirmed what that study showed? So even when people are trying to do very legitimate and careful science, you can have a finding that just happens to happen and can't be reproducible. So I think the first thing is, ask, have we seen this before? Have other scientists or other experiments demonstrated the same thing? Is this consistent with what we've seen in the past? Also, the question is, does this make sense from a biological standpoint? So a lot of the studies that we're seeing are very quick correlations. And the trouble is you'll see studies of small groups of people, and they say, okay, we found this correlated with this. We have to remember that correlation or association does not mean causation. So just because two things appear together doesn't mean that they actually have a cause and effect relationship. I'm sure you could find a cause and effect relation or an association or correlation between like people wearing red shirts and many different things, but it's not like the red shirt causes a medical or scientific effect. So I would say really dig into the science, really determine like who else has seen this. And if it comes to a situation where you still are going to report it, make it clear this is a single study. This shows an association. We need future studies or further investigation to really confirm this.
Yes, those headlines that we see making rather odd correlations, yes, we do see a lot of them, and it can be very misleading for just ordinary people who are not experts at all on medicine. Well, Mr. Kaplan, before we go, of course, as non-medical experts, most members of the public simply don't have enough medical or health knowledge, really. They don't know all the facts to distinguish what's actually true or false. So what are some ways that people can actually use to spot fake news when they see it?
Yeah, it's hard to understand scientific studies like that. The other challenge is that most people have a terrible grasp of basic statistics, which is the underlying thing that scientists rely upon. Is this a population that's large enough to be extrapolatable? Can we take this small study of 5 or 10 people and say it's going to be big enough? So very hard for consumers to know what's going on. Look, I would advise people to lean back on the sources that they know about. There are a number of initiatives from a number of large news sources and social media sites that are designed to make it easier to spot things. So for example, Facebook announced just this morning they're going to have a coronavirus information center that pops to the top of your news feed. If you're looking for information and if you rely upon Facebook for news, which honestly too many of us do, but it is a fact people do that, turn first to this. It's a resource that they have custom built and are making sure is populated with all the correct information. Facebook said the same sort of thing is going to come to WhatsApp, another platform that they control. So look for those types of resources, trusted resources, or curated bits of information directly from a knowledgeable, reputable source, rather than leaning on the text message you just got from your next door neighbor who happened to have heard something from some guy down the street. We often find bits of information like that are shared socially, and they're oftentimes just misleading or outright false.
So it really boils down to going to credible sources for information and maybe not necessarily trusting every single headline that we see to grasp our attention. Well,
the first thing they train you as a journalist is don't trust anything out there.
Exactly. Don't always, have room for doubt and always question what you see. Well, that's all we have time for today, I'm afraid. But our viewers can follow Bruce Wiley's articles on the issue and Jeremy Kaplan, Editor-in-Chief of Digital Trends, for more on how to spot fake news on the coronavirus especially. Thank you both for joining us all the way from New York.
Thank you. It's been a pleasure.
This is where we also wrap up our show today. Join us tomorrow at the same time for more global insights on issues making headlines. As always, thank you to our viewers for watching and have a good one.